This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the CommonHealth podcast.
Hello, and welcome to CommonHealth, a podcast brought to you by the Virginia Community Healthcare Association, or VCHA. I'm Tracy Douglas, VCHA's CEO, and your host for this episode. On CommonHealth, we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by community health centers here and those who serve them. Hello, everyone, and thank you for joining us today at the CommonHealth podcast. Audience, that this is a podcast that's brought to you by the Virginia Community Healthcare Association, or VCHA is how we like to go by. I'm Tracy Douglas. I'm your host of today's podcast. And on CommonHealth is we like to discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by community health centers here and those who serve them. And so again, audience, you know I like to just bring our voices to the table because so much tends to be drawn out with some of the latest media that's out there. So these are just common folks with common great things to share that's coming out of the Commonwealth of Virginia. And today I'm excited to introduce to you our guest for today's episode. And she actually comes to us because she works at Virginia Community Healthcare Association. And we're quite excited that we have someone with her expertise that has joined our team. But even though she works at VCHA, she actually is here for our patients, the patients here in the state of Virginia. And the way that folks will be able to get access to her is through our community health centers. And again, we have 30 community health centers here in the state with about 180 locations throughout. And so she's going to be a busy woman. And Adrienne is who we have today, audience. And she is a nutritionist. She's a registered dietitian. And she's got over 5 years of clinical experience. She's responsible for addressing the unique dietary needs of a diverse patient population through comprehensive nutrition assessments, nutritional counseling, and education to patients at our member community health centers. Oh, and by the way, if you are a patient at one of our community health centers, this is services that we're going to provide to you, yes, free of charge, through a very generous grant that we were able to get with a partnership from Blue Cross Blue Shield here in Virginia. Before joining VCHA, she worked with adult and geriatric patients in hospital and long-term care settings. She's also collaborated with local community programs to educate children and adults on healthful nutrition. Adrienne graduated from the University of Virginia with a double concentration of Bachelor of Arts in Sociology and French, and completed her Bachelor of Science degree in dietetics at Virginia State University. Yes, she is. She knows some French, and we've heard her speak some French in the office. Adrienne enjoys public speaking, cultural experiences, and helping people develop and maintain a healthy relationship with food. I love that. Healthy relationship with food. Yes. Gosh, if only I could adopt that more. And yes, and now that we have you working, Adrienne, at VCHA, I am depending on that. So thank you. Now, Adrienne, before we get into talking and sharing with our audience your love of nutrition and a bunch of other things we're going to talk about. I know you love these cultural experiences, and I really want to hear from you. What does that mean to you? What is that in your life today? Give us some examples of what that is to you.
Sure. I want to say, first of all, thank you, Tracy, for having me today. I'm so excited to be here, so excited to speak to everyone. And for me, cultural experiences can be so broad, but I had the privilege of living in Europe for about a year. And while being there, it really opened my eyes to how different living abroad can be. And it wasn't like a study abroad program, like I was living and working abroad. And so to learn about the culture and to travel to neighboring countries as well within Europe and to see different cultures within each country, even down to maybe the times they eat, the types of foods they eat, how they get around with transportation, how common it was to use the bus or bike or walk, and even certain cultural practices, what was considered normalized. Like even if you eat fish, it was custom to eat the eyeballs and have the head of the fish on there, and different things that maybe in American culture we're not as accustomed to. And so for me, culturally enriching experiences are anything that broaden your own horizon of what cultures you're familiar with, and it can expand upon that. So it can be anything outside of your kind of day-to-day or your comfort zone.
All right. I know for us, we are excited because in community health centers, we have a diverse population that we serve. And I really think that your experience abroad, although you're experiencing those different foreigner type cultures here in our population, we have such a diversification of perspectives and cultures and ethnicities. And so we really think that's going to be very valuable when you start working with many of our patients. Now, Adrienne, this is National Nutrition Month. And that being said, we do have to talk National Nutrition Month with you. And the theme of National Nutrition Month is beyond the table, Adrienne, focusing on the farm to fork aspect of nutrition, from food production and distribution to navigating grocery stores and farmers markets, etc. And with that said, can you tell us the importance of National Nutrition Month in your view?
Absolutely. A little bit more background. National Nutrition Month is every year in March, and it is an annual campaign that is put on by the Academy of Nutrition and Dietetics. It started in 1973 too, so it hasn't been around too long comparatively to other maybe national celebrations. But yeah, so you were asking, why do I think it's important? For me, I think National Nutrition Month is extremely important because it puts nutrition on the forefront and makes a focus out of it for everyone. And as we know, nutrition is so important to just our day-to-day living, right? And so to make nutrition visible, to provide resources and realistic ways to incorporate this nutrition information into your day-to-day life, I think it's extremely important. And RD Day is actually on March 13th this year. It's on the second Wednesday in March every year. So that celebrates all of our registered dietitian nutritionists like myself. And I think that's great as well because the work of nutrition professionals is so vast. We work in so many different settings, clinical settings, food service, community, private practice, corporate wellness, even military. I think it's great to highlight not only who dietitians are, but some of the work we do because it's usually unseen, believe it or not.
Mm-hmm. Yep. And I mentioned when I was describing National Nutrition Month and how we are this particular time of year, you and a lot of your colleagues focus on this farm to fork aspect of nutrition, right? Farm to fork, listeners. What does that mean, Adrienne?
I love that question. So farm to fork really means learning and understanding where your food comes from. So a lot of times especially I can speak to our modernized society, we're used to maybe just going to a grocery store, or maybe we go to a fast food place, or we're eating out at restaurants, and we're not really seeing the full process behind the scenes of where is this food grown? How is it grown? Where are some local areas we can get this produce? What does fresh produce even look like? I know sometimes I think people are shocked when they see how asparagus grows out of the ground or like how certain vegetables actually look when they're being grown. So I think it also speaks to the importance of local foods and understanding how a lot of our foods are imported and they come from very far away. So learning more about what are some local places we can actually get our food? What are some farms or farmers markets or even community gardens where we could get some fresh produce? And even learning how to understand how to shop in season for certain produce. So I really think it's really getting people back to the basics of understanding produce and where our food is grown and comes from, and even farming in general for me.
You mentioned that, and we have done a show, Adrienne, 2 or 3 shows around rural healthcare and some of what's meeting the needs of those who live in rural America and here in the Commonwealth in Appalachia. And many individuals who come from, say, the Appalachia here in the Commonwealth, they rely a lot on the land. But yet they also don't, a lot of folks in the Appalachian area don't have access to like grocery stores like maybe folks in the urban setting. How do we help our comrades who live in rural America and in the Appalachia? How do we help them to understand the importance of nutrition? And when they don't have the kind of access that maybe folks who live in the city do, who have multiple grocery stores, but grow their food, store their food, right? How can we help them? And what's our message to them? What's our message to them?
Yeah, no, that's a great question. I think there are a few ways we can approach helping. So I think the first thing is understanding like what they already have access to and maybe figuring out what's lacking so we can see where we can fill in the gaps. Because maybe there's a way that there are programs or certain partnerships that we can have that can help fill in those gaps of maybe the produce or the items or those grocery store staples that may be missing from their crops. So I think it's really about also educating them on what is available. I think a lot of times when you are out in rural areas, you may be disconnected from some of those resources that could be common if you live in the city or common if you're a part of certain programs. So I think one is really trying to understand our patient population is number one, understand what they already have access to and maybe some of the things that they need. Then the second piece is education, really truly connecting those people with those resources and let them know what's available and figure out ways we can maybe get that service to them. Because now there are so many programs out that are trying to make food more accessible and really truly bridge those gaps of food insecurity. So really trying to make sure that people are connected with the programs in their area and maybe even teaming up with other locals who may be going into those areas more often. And maybe there's groups that will go into the city or go into those areas and bring things back. So maybe they don't have to do that travel, especially if they have a disability, or there could be another barrier, figuring out a way to connect them with the people who can.
So I'm going to flip it now. I'm going to take us from the rural setting and I'm going to take us more into the urban and suburban setting. And one of the things that always strikes me is food waste, right? Food waste.
Yeah.
It strikes me because listeners, I'm in healthcare. You have to understand these are the kinds of things that as healthcare providers, we notice a lot of things that are occurring in our environment that we feel can help patients, can help you in some form or fashion because you will have access or you will have to tap into the healthcare system in some form or fashion. And nutrition is so important with regards to healthy living, right? But when I look at food waste, right, and especially for individuals who are unhoused, and we see many unhoused individuals who come to community health centers, go to hospitals, how can we start to be more compliant or participative, Adrienne, in helping reduce food waste so that everybody has access to good nutrition?
I love that question because food waste is something that I absolutely despise. It is like huge on my list of things that if I could combat it all in one day, I would. And the concern here is food waste is so multifactorial, right? Because food waste looks different depending on what you're talking about. Sometimes it has to do with food spoilage, like the food just didn't get to the consumer in time. Sometimes it has to do with excess production. So meaning there's so much, but it doesn't get to the person in time, or it doesn't get allocated properly. Sometimes it just has to do with maybe someone getting the food, but never using it, not knowing how to use it. I really think when it comes to food waste, there's a few approaches I personally think of when I think of how to reduce it and how to help eradicate it. One of the approaches is really and truly making sure that we help patients and help people understand food safety, right? Because a lot of times food waste can come from not even properly understanding how to store the foods, what the time temperature danger zone is, and some of the things that have to do with food safety that get overlooked. For example, not even understanding cooling and thawing and reheating practices, which you can go to foodsafety.gov for more details on how to do that. But there's a lot of things about food waste and food spoilage that I think there's an educational gap. And if someone gets this food, maybe let's say someone is unhoused and someone says, hey, I'm going to give you all this food. They might accept it, but have nowhere to store it. So then the food goes bad and they can never use it. And that's unfortunate. And I think some grocery stores are doing a really good job with ensuring that they team up with the local food bank so that their food does not get wasted and it actually gets donated appropriately. So once again, those partnerships I think are really important. Hospitals partnering with food banks as well. I know there's some programs where they might, when someone screens for food insecurity at the hospital, they'll get connected with a box from the food pantry. And there's a lot of different programs in place to help people receive those resources that may have otherwise been wasted, or those resources and those donations actually get allocated to the people who need them. So I think just improving that communication between organizations as well, so that the food gets to the people who need it, and then creating the infrastructure for that food storage or those soup kitchens and soup pantries for our people who are unhoused, so that they can receive these hot meals regularly and don't have to be concerned with that spoilage of trying to take it with them wherever they go. They can eat those hot meals and maybe receive a box with canned goods or dried storage goods or things like that can travel with them as they get access to maybe a microwave or something like that.
So let me ask you something, Adrienne. One of the things I always thought about was many of our community health centers have access and partner with food banks or have their own food pantries. And I say that to say, are there other things that we can be doing as a society, as healthcare providers, to help contribute to ensuring that everyone has access to a nutritious meal, right? Or something nutritious. One time I can remember taking my dog for a walk and I'm looking around the neighborhood and I'm seeing all this bare land or a vacant lot or something like that. And I've always thought, could we come together, some of us come together and, I don't know, plant apple trees or fruit trees or have community. What is it that we could do to help with ensuring that all people, and I mean it in that way, has access to nutritious food?
I'll say that what you mentioned is something that I thought about and I've been doing some research on. I really like the Unity Gardens model. I don't know if you're familiar with that, but it's essentially like where someone kind of hosts this garden that people can come. It's not like a community garden where everyone has their own plot. It's under the premise that anyone at any time can come and benefit from that fresh produce. And I think that making the thought of even at-home gardening or at-home, because you can do herbs, spices, and certain small-scale things even in your home. And you don't have to have some fancy container. You can sprout seeds from an egg carton or from leftover things. Like if you really truly dive deeper into, again, back to that farm to table mentality, where does the food come from? Seeds are usually the most inexpensive form for whatever fruits and vegetables you're looking to grow. And so if we can get it more normalized for people to start sprouting seeds and learning more about that process and even planting things that can grow well indoors. And then, like you said, maybe having that sort of model where we do see more apple trees out and about. We do see more community gardens and maybe even that unity gardens model. I definitely think that's something we should move towards. And even teaming up with local farms. Sometimes we don't have to reinvent the wheel. We just might have to figure out, like with the farm bills, they're trying to make it more profitable for the farmers. And they have a lot of these food RX programs or these food pharmacy prescription programs where people might get a token and it's worth double the value of maybe what their SNAP benefits are worth. So it encourages them to go to those farms and use those local resources. I definitely think getting that connection back is super important for us to understand how inexpensive it really can be to get that fresh produce and maintain it, especially if you can team up and work together.
You'll see in neighborhoods, Adrienne, you'll see like somebody would start like a little mini food pantry. It's not a refrigerated type pantry, but it's out on the corner and people can contribute to it with products, food products, so that someone who is struggling with good nutrition, accessing good nutrition or nutrition just in general, feeding themselves or their family. That's why these types of things exist around neighborhoods. What are some examples that people could put in those little mini food pantries that are around their neighborhoods?
You mean as far as produce that will keep and doesn't need to be refrigerated?
Yes.
Oh, okay. I would look deeper into I would do it by season first. I would always do it by season. But I would think of things that are easy to keep and last a long time, like potatoes. I would definitely do sweet potatoes, white potatoes, red potato. Tomatoes are a great one as well. And then cucumbers, believe it or not, you typically don't have to refrigerate those. You can get cucumbers, you can get there's tons of different produce, onions and different things that grow that don't need to be refrigerated, garlic. And so I would encourage lots of different fruits too, apples, pears, bananas. So I would definitely encourage some of those kind of hardier fruits and vegetables. And like I said, try to go for the season. A lot of them overlap as far as what seasons they are fresh and ripe for. And so in the wintertime, like some of your specific squashes, like your winter squash, your acorn squash, your butternut squashes, those are usually only in those kind of fall, winter months. But be aware of when those things are ripe. But there's so much fresh produce that you can have without needing it to be refrigerated. And it's really hardy. It lasts a long time.
And what about canned goods? What kind of canned goods can we put in there?
Honestly, anything that you can find and anything low sodium if you can help it. I highly encourage incorporating canned goods as a part of good nutrition. And a lot of times people are shocked when they hear that from a dietitian. They're like, wait a minute, I thought that you have to have organic, you have to have fresh, you have to have this. You don't. Actually, as long as you're getting in those nutrients, we do recommend fresher is better, but even something flash frozen, it's just as good as fresh. And if you get something canned, you're still getting those nutrients. So I recommend canned green beans. They have canned beets. They even have canned potatoes. They have almost everything. Fruit, a lot of the fruits that are canned, I recommend that you get it in its natural juice. So no high fructose corn syrup, just its regular juice. And it's the same thing with those kind of other vegetables that you'll see, the corn, the peas, the green beans. Get those in just water and try to get no salt added or low sodium. And if you cannot get that, either way, rinse it off. Rinse off the excess sodium that is used to help preserve those vegetables to make it a little bit more heart healthy and nutritious for us all. And yes, absolutely. Anything they can find in the can, I would say go for it. Even mushrooms they have in the can. There's so many fruits, vegetables that you can find as canned goods. Even vegetable soups and combination foods.
When you had, that's why I segued into canned goods, because I remember you and I talking about canned goods, and you had shocked me when you had said, when we were first talking about this, that you encourage it. And I was surprised because we're always told to stick with fresh as we can have our food be. And so I've become more in tune, right, with our canned goods that I purchase. And I've been more open to the idea of exploring canned foods that I might not have even thought about based off of our conversation and what you just shared.
Yeah. And even with proteins, I think meat can be very expensive. So canned beans, canned tuna, and different sort of canned proteins, even canned chicken. A lot of canned proteins can be a lifesaver for a family who may be battling with food insecurity or just really need to save money at that time. We all go through different stages in our lives where money could be tight. It doesn't matter if you work full time and do this, that, and the fourth. Anyone can have difficulties with their financial status at any moment. And I love to debunk this thought that, oh, only a certain group of people who make a certain amount of money. No, anyone at any stage of their life can have difficulties financially. That's just a fact. So to understand that is also to understand how important it is to make nutrition accessible and affordable for everyone. So that includes not only learning and educating people on what good nutrition is. I tell people all the time, go to myplate.gov and get the basics. Learn about fruits, vegetables, grains, protein, and dairy. Learn about your food groups, because I guarantee you, if you go to most fast food restaurants, the only food groups they have are protein and some sort of starchy vegetable that's not even a vegetable anymore because it's usually a French fry, right? Mm-hmm. So I would much rather a person come to me and say, hey, I eat out for every meal. What can I do? Where can I start? I want to eat more vegetables. I'll say, okay, do you have a can opener? Because maybe it's just a matter of you having those string beans ready to go, something easy and quick because you're on the go so much. And you got that can, you rinse it off, boom, you can throw that in a microwave. Or, truth be told, you don't even have to microwave. You can eat it straight out of the can. I've had truck drivers that I've counseled with before that literally brought their can opener, brought it on the truck, and that's how they got in a serving of vegetables. I kid you not. It's one of those things where as dietitians and as nutrition professionals, it's so important to rope us into these conversations because we are the experts for a reason. We are willing to work with people wherever they are, and we understand so many fundamentals of nutrition, whereas maybe a blanket statement from another provider that's not an expert in nutrition might just say, oh, no, you can't do this, you can't do this, you can't do that. So the person says, okay, I just won't try. So what we're trying to combat is this all or nothing mindset. We're really trying to encourage, how can we take those baby steps to get you closer and closer to incorporating real foods that are nutrient dense. I will stress that. It's very important to understand the difference between a calorie dense food and a nutrient dense food. Whereas calorie dense is what most fast food places offer. Really high in calories, low in the nutrients and nutritious value. Whereas if you focus on nutrients dense foods, which include those canned foods for those fruits and vegetables and proteins, then you can encourage those foods that also usually have more fiber, so they keep you fuller longer, and they're going to add that nutritious value to help you be a healthier person. So that's really important to really encourage dietitians in those conversations with these people who are struggling with their nutrition at any level.
You shared a lot with us, and I do want to go to looking at some of the trends and controversies around nutrition. And what are some of those trends or hot topics in the field of nutrition that you're finding interesting?
So many. I'll say my fan favorite right now, and I think a few people around the office have already heard me talk about that, but one of the trends and one of the big topics in nutrition that I'm interested in is weight management and obesity. So I think that right now, when it comes to nutrition and what people expect from dietitians, it's usually something to do with managing weight or managing obesity. And although that is one sector of nutrition that is very vast, even down to bariatric surgery, there's a lot of specialties. You can also get your certification in weight management and as an obesity specialist as well. That is a whole sector of nutrition. I think there's a lot of misconceptions around obesity and weight management that need to be addressed. I don't know if you want me to go in detail on which ones I think those are, but
what I was going to do is take you down the road, taking what you shared there around obesity and weight management into, because a lot of what we are seeing in healthcare around that, unrelated to nutrition, is where that person is in their mental health, right? And how can nutrition help with someone who's struggling, right, with their mental health and it's potentially impacting their weight, which then can lead to such other comorbidities, hypertension, diabetes, and things like that?
I think that the first approach I take is always look at what does that person really need, as far as if their mental health is an issue, are we really truly taking it seriously? Are we connecting them with mental health providers? And the good news is, even throughout nutrition counseling, most of the time, you'd be surprised how much of nutrition counseling 101 is not just me as a provider telling you what to do. It's more me listening, understanding what's going on, and providing that space for this person to discuss what their barriers are, what their struggles are, and then collaborate with them to figure out how nutrition fits into that puzzle piece. So the beauty of that is also you get to uncover a lot of those mental health concerns. And some of them do require a higher level, meaning they need to go see someone, a behavioral health specialist. And that's the importance of a multimodal interdisciplinary approach, right? We always want to work together as a team to ensure that their doctor is aware, a behavioral health specialist is aware, their nurse practitioner, if they have one, is aware, the dietitian's aware, the whole team is working together to give this person the care that they need in each specialty. And then when it comes to nutrition, sometimes depression is the one we see the most, at least in my experience. Depression and anxiety and binge eating disorder are the three that I see the most that have affected obesity or weight management in general. I've had patients who they'll sneak food and they'll hide food because they're afraid to eat in front of people, because they're afraid of being judged, because they've been stigmatized because of their weight. And so when I talk about some of the misconceptions about obesity and about weight management, it's really important to debunk a lot of the stigma that comes with it, because people with obesity are just like people with diabetes, or just like people with any sort of anything.
Disease.
That's not who they are. That might be something that they're struggling with, or something that they may want to change, or something they may not want to change. You'd be surprised how many referrals I've had where the patient did not even want to talk about their weight, but yet I got a referral about their weight without someone ever even consulting with the patient. So again, that patient first, patient centered approach is the only way, in my opinion, that will actually get to the root of some of the issues that can lead to those chronic conditions down the road.
Adrienne, I'd love to hear from you, and if you could share with our listeners any memorable success stories or patient outcomes that you've experienced in your practice.
I had a client who he struggled with his weight for as long as he could remember, and he kept doing these extreme fad diets, yo diets, to the point where he was hospitalized because his kidneys almost failed because of some supplement he had taken in excess, and he could have shut his kidneys down, essentially. So by the time he got to me, not only did he have this fear around certain things pertaining to nutrition, he also felt hopeless, is the words that he used. He felt like he didn't have anywhere else to turn, and he didn't know what to do. And thankfully, it was actually through his wife that he came to me and he said, I'm ready to start. So I worked with him for almost a year. We met weekly, then we met every other week, then we met once a month, and then we met monthly after that. And then we tapered off, so on and so forth, for about a year. And the biggest success story was not only his weight had plateaued completely at first, this man lost 20 plus pounds without looking at the scale and focusing on the scale. We did get a starting weight. But I was talking to him and I was like, listen, I don't want you to weigh. He would weigh himself almost every day. He was obsessing over his weight. And I was like, I don't want you weighing yourself every day, at max once a week. But honestly, you can forget the scale. It was all about empowerment. I taught him about nutrition. We focused on the areas that he wanted to change, and we did not focus on weight, because I have never met a person, and you tell me if you have, Tracy, I've never met a person who could walk up to the scale and say, all right, scale, you're going to say this today. No,
Right.
You can guess, but you can't dictate what that scale is going to say. But what you can do is dictate what you pick up, what you put in your mouth, how many times you get up and go for a walk, how many times you have positive self-talk, what your sleep patterns look like, how often do you journal or Write these things down. How do you make, there's so many other aspects we can control. So giving that power back to a patient or a client is a huge, that is one, that's my biggest success as a provider. But two, to see my client not only empowered to do better, but to keep the weight off. I just checked in with him a few weeks ago, and it's almost a year later. He's maintained the weight that he lost. And he said he's learned and he feels empowered. And I told him, I said, I'm always here for you. If you want to ever hop back on, you need a refresher. But he's flying solo now because it's more about empowerment. And I tell everyone, I don't want you to keep needing me. The goal is that you won't need me for very long, because I can't go with you every time you go to a restaurant. I can't go with you every time you sit down at the table to eat or to cook dinner. I won't be there. So if I'm not doing my job to educate you and empower you and help you learn how to do these things on your own and be self-sufficient, then I'm not being a very good provider.
And I want to end this by asking you this question. How can we enjoy our food and look forward to a meal without feeling and walking away feeling guilty what we just ate?
Such a good question. Tracy, you sure you want to end with that question? Because I got a lot for that one, but I'll cut it.
Bring it on, Adrienne.
So guilt and shame. Oh my goodness. Guilt, shame. There's so many things that go along with food phobias, food rules. I'll say this. The first step to not feeling guilty about food is to take the power away from the food and put it back with yourself. The food itself is neither good nor bad. I don't care what it is. Ice cream, it's not good or bad. It just is or it isn't. It either has this amount of calories, it has this amount of fat, it has this amount of protein, or it doesn't. An apple, it's not good or bad. It either is or it isn't. It has this amount of carb, it has this amount of vitamins, it has this amount, or it doesn't. For us to look at food and we attach emotion and power to the food, that's usually, not always, but it's usually one of the roots to why we feel guilt and shame around food. So I think looking at food and reframing our mindset to tell ourselves, okay, my goal is to eat as many nutritious meals as possible, but every meal is an opportunity. If I eat something that maybe doesn't align with my goals, and that's what I always tell clients, patients, everyone, does it align or does it not align? Does it promote weight loss or does it promote weight gain? What does it do for you? Because someone may want to gain weight. Okay, let's add calories. Let's add fat. Let's add protein. Someone may want to lose weight. So let's decrease certain things, right? Let's lower the calories. Let's lower the fat. And when you eat something, if you start to feel guilty, if you start to feel shameful, ask yourself why. And ask yourself, what did that food do to you? That food doesn't have anything attached to it. And whatever is attached to it for you, that's what takes a little deeper exploration. But we have to look at food as it is or isn't. Just like when I go out to eat, I ask myself, do they offer options that are nutrient dense? Do they have grilled chicken instead of fried? Do they have a side of broccoli instead of just fries? Sometimes I want both. Maybe I'll portion control and do half of the fries and half of the broccoli, and I'll have half for later. I ask myself, what are the properties of those foods, and am I eating a balanced amount of them all? Based on the My Plate model and also somewhat within the Mediterranean diet, we know that over half of our meals should be fruits and vegetables off rip. And there's a huge encouragement to increase plant-based foods, including plant-based proteins like those beans, lentils, and so on, peanut butter, so on and so forth. Even eggs, even though it's not plant-based, are a great source of protein as well. Nuts and seeds. So we need to look at food as it either is or it isn't. It either has this or it doesn't. And that is my biggest start for how to reduce the guilt and shame around food.
I love what you said when you started to answer the question. It was to take the power away, take the power that we gave that meal, take it away and bring that power back to us, and then look at it as what it is and what it isn't to us. And I love that. I just love that approach. And I'm going to start to hopefully remember that, use that for myself, because I think that's great advice. So I'd like to thank Adrienne for joining us today. And thank you to all the listeners for turning into Common Health, brought to you by the Virginia Community Healthcare Association. And listeners, I would be remiss if I didn't say this. I know I try and say this as much as I possibly can. If you enjoyed this episode, and what's not to enjoy about this, Adrienne is fantastic, and you'd like to help support Common Health, I encourage you to please hit that subscribe button, share it with others on social media, leave a rating and review, and of course, visit our website at VCHA.org. And with that, Adrienne, thank you. Listeners, thank you.
Thank you so much.
Thank you.
I want to thank my guests for joining me today. And thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit subscribe button and share it with others on social media. Leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas Wheeler, and thank you again, and I'll see you next time.